Joining me on the line is Dr. Mohammed Emran from Houston, Texas. He is an ER doctor in Texas, and he just launched a recent new podcast called Simple Health Radio. Dr. Emran, it's a pleasure to make your acquaintance here.
Thank you so much for having me on the show. I do appreciate that.
Well, how long have you been a doctor? And I guess a follow-up to that question is, what inspired you to start a podcast?
Well, I've been a physician for almost 13 years, and the reason I created this podcast was because of my work in the hospital emergency room. I was seeing a lot of patients with similar problems over and over again, and I thought about putting it into a format where I could allow patients and their families to listen or read about some of the health conditions in a safe place, meaning in their own home or on their own iPhones and Android devices.
It's interesting how social media and the internet has changed so drastically over the last 10, 15, even 20 years. And now that we're seeing people out there, doesn't matter who you are, really. You could be a doctor, you could be a construction worker, you could be just about anybody. If they want to brand themselves and get their name out there and get information out to the public, they're able to easily do that, whether that's a podcast or a website or anything else.
Absolutely. And a lot of my patients do go to the internet before they come to me in the emergency room. They've tried to Google their own symptoms or go on some of the other websites to find out or diagnose themselves. The dilemma with that is they always have a very broad differential diagnosis. So they type in sore throat or they type in back pain, and they'll come up with some very scary sort of situations, which are usually never the case. So my goal was to really create the podcast in a simple format, very easy to follow, very clear directions as to what we do for testing, how the treatment plan is made, and what to expect when they go to the doctor. And that's where the name Simple Health Radio came from.
You know, it's interesting mentioning that. I think everybody has done that a time or two. I know I have done that, and my mom is also a nurse practitioner. So sometimes I go to the internet before I even talk to her, and it's interesting. Sometimes you look up stuff, and it'll say, you should see your local doctor. So it sounds like, in a way, you know, if they go to the internet, they'll be able to see a doctor and give them get some information that way as well.
Absolutely, and I agree with that. A lot of many people who are young, healthy, active, and so on go there just to see about their own health, how to stay healthy, promote wellness, and so on. So not everyone who is sick is actually going to the doctor. It's actually a lot of people who are trying to avoid the doctor, trying to get information also.
Tell me a little bit about what you do when you put a podcast together, and tell me about some of the episodes that have gained you a lot of followers and interest and questions.
Absolutely. So on a typical day, a busy day in the ER, I might see 40 or 50 patients, and a lot of those patients will have similar complaints. And so what I usually do is try to choose a diagnosis where I've had a lot of recent exposure. So, for example, appendix, that comes up on almost every other shift. So the appendix is a serious infection. It's life-threatening, and I always have the same conversation with the patient and the family about what to look for, how the surgery is going to go, and what else to be aware of after the procedure is done. And so that's where I usually get my inspiration for each podcast, is if the patient were sitting in front of me, how would I explain it to them, and how could I diagram what they need to be aware of? And that alleviates a lot of the fear. That way they are not so apprehensive or so scared about going to the hospital, going under anesthesia, and so on. But not just for the patient. It's actually for the family as well. Husbands, wives, children, they're almost a part of the diagnosis also. And usually when I explain it in a very clear format, I offer to speak to other family members at home or talk to their spouse or grandmother, someone who's at home or unable to come in. And that really goes a long way. More than any medication, I think that goes a long way to get everyone on the same page. And it's actually been proven to help outcomes, meaning patients follow the directions better, they take their medications on time, and they know what to do and how to do it, basically.
Tell me about some of the different podcasts or episodes that you have put together. I know that you have mentioned to me about the CBC blood test. Tell me a little bit about that and some information that you've been able to give out to people regarding that.
Absolutely. So the CBC is called a complete blood count. This is one of the most common blood tests in the world. It's done literally every single day in clinics as well as hospital emergency rooms. But I'm often surprised when I explain the results to a patient who's sitting in front of me that they've never had this conversation with their own doctor before. So one of the podcasts I did recently was about what numbers we look at when we do a CBC. And it's very simple. We look at our white blood cell count, we look at the red blood cell count for anemia, and we look at the platelets, which is basically how we create scabs and clots. And when I break it down, people all of a sudden start to think back to their own lab results, and then they explain to me, I was anemic before, this was my number, now you're describing a higher value, so I think my treatment is working. Or they'll tell me the opposite. Well, they'll say, well, my doctor said I was okay before, but now my numbers are trending down. And so that podcast, when I created it just about the CBC, generated so much positive feedback. People who had never, ever had a conversation with this figure with their doctor before thanked me, and they were really appreciative of that. And as I said, it's such a simple thing. It's almost like you would go to a mechanic to get your oil change, but you never really ask what kind of oil goes into your vehicle. This is the same idea. You have to start at the basics, keep it very clear, and I think people really benefit tremendously from that.
Dr. Emran, maybe you've gotten this question before, because this is kind of the first thing that comes into my mind. You're a doctor. How do you have time to put a podcast together with what you do?
Absolutely. It's something that I call work-life balance, and it's a big push in a lot of industries, but especially in the medical field. So normally, doctors, as you said, work a lot of long hours. I work days and nights, so I have a rotating shift. But I always make time to talk to my patients live and in person to be sure that they're satisfied before they go home. And when I go home, I try to put that all to the side. And so I make time for myself and my family. And that's when I usually make some notes and just have a conversation with myself for 10 minutes about what I think I need to explain to other people. And it's always good to keep that work-life balance. People who overexert themselves in one way or the other, unfortunately, it impacts their own health. And so as doctors, you'll see a lot of people go golfing, or people take vacations, or they'll just go for a long drive, and that's their way of releasing some of all the negative, diagnoses and problems and health issues. So it's a good point. I think we all should have a chance to decompress, if you will.
Your website is simplehealthradio.com. That is simplehealthradio.com. The question I have for you, Dr. Emran, as well, is for somebody who is a professional, or maybe they're not a professional, but they have something interesting they want to talk about, and they've always thought about putting a podcast together, and they're really not sure how to start. What do you say to those people?
I would say that the technology that's available today is so simple, and if you have something as simple as an iPhone or an Android device, that's really all you need. There are many, many websites out there that are completely free. They'll host your own podcast. They'll give you tutorials and straightforward methods of how to develop a topic, how to do the conversations, and then how to upload it. So pretty much any 12-year-old child in America could set it up for you if necessary. But for the adults, there's a lot of resources out there, and that's basically how I got started as well, was just putting together my thoughts, and then I went online. I just selected a service, and they walk you through it very, very easily. So it may sound intimidating to be putting out a podcast on a regular basis, but truthfully, it's the same as having a conversation. You're just recording it for the benefit of other people as well.
See, I'm in the radio field, and for me, automatically, when I first heard about podcasts, because even for radio people, it's a new thing, they're thinking you have to put this long, elaborate show together with hours upon hours, with guests and elements and everything else. But the truth is, you really don't have to put that much content out there. It can be something really short if you want it to be.
Absolutely. And a lot of the research that I did when I developed the format for my podcast was just that, to keep it as simple and short as possible, not only for attention span, because after 30 minutes or an hour of talking about the same topic, naturally your mind begins to wander. So it's best to keep it to the point, answer a question or two, and then make it fun and entertaining at that point. But also it helps the author or the person developing the podcast keep their ideas separate. So the flow that you have in your mind, you're going to think about 3 or 4 different things, but it's best to stick to one topic, clarify it, be thorough with it, and then save another topic for another day. And that allows the listener as well to remain engaged. And the feedback that you get from your listeners will guide you for the future episodes as well.
And just kind of taking a look at your website and also your podcast and some information that you provided on your blog as well, I'm noticing that a lot of the topics are very easy to understand for the average person who's just interested in some general health issues, but at the same time you do delve delve into some things that require a little bit more detail as well. When you're putting your blog together, what do you think about, and as far as technical details are concerned, and how do you get it to the point where people can understand it in layman's terms?
Absolutely. So I have something what I call a sixth grade test. So if I had a sixth grader sitting in front of me and I was trying to explain to them a very scary topic, for example, a broken bone or an infection that's in their stomach, how would I talk to that sixth grader? And sixth graders these days are pretty smart, but you still have to be able to communicate with them on their level. And so that's where I started from, is what are the few things that they must know? And I put those in the first part of the blog itself, and then I branch out from there. So I do include vocabulary, which is medical terminology, because a lot of doctors will speak that way even to their patients. And the patients may not know what the words mean, but they'll remember them or they'll write them down. So I always try to define the medical terminology that doctors use among themselves, and that's the terminology that will be used on your chart. So, for example, if you get a copy of your medical records and you try to read your own lab results, it's going to be very challenging. So my first step is always to define what are we actually looking for. The second thing is I always include references to reliable sources, so places that are published on a regular basis, like the CDC, which is the official Centers for Disease Control, Harvard Medical School. You know, some of the very large, well-known, authoritative organizations put out a lot of information and content, which is, I'd say, better than Google or some of the other websites, because these are written by doctors for patients. And so I always try to keep it balanced. So I put my perspective out there, and then I give a branch out to some of the other groups as well.
Dr. Mohammed Emran is my guest, and his website is simplehealthradio.com. He does a podcast on a regular basis. How can people find you as far as your podcast is concerned, Doctor? I understand you are on iTunes as well.
Yes, sir, I am. So if you go to iTunes and just type in Simple Health Radio, it's a free subscription. I don't charge anyone for any of the content. I don't sell anything. I don't charge people for any of my services. This is really just to engage with the listeners. I'm also on Facebook, Simple Health Radio. I'm also on Instagram, and I'm also on Twitter. And there's a lot of different ways to submit your feedback. If there's a topic or a question that you have, I invite people always to send that to me. I can't directly respond to the questions due to medical liability laws, but I always take those questions and I use them on a future episode, and I branch out and offer additional advice as well.
My guest has been Dr. Mohammed Emran of Houston, Texas, and we appreciate you stopping by today.
Thank you so much, sir. I really appreciate your time today as well.